Welcome to the Deep Dive. Today, we're going to be exploring a fascinating new technique in veterinary neurology, 3D printed guides for brain biopsies in dogs. You sent us a research article detailing this cutting-edge approach, and we have our expert here to kind of help us unpack it.
Yes, the study uses canine cadavers to assess the accuracy of these custom-made guides, with the goal of achieving more precise brain tissue sampling.
Okay, so before we get into the specifics of the study, can you remind us why getting a brain biopsy in a dog in the first place is such a challenge?
Sure, brain biopsies in dogs pose a unique set of challenges. Canine nervous system tumors are unfortunately relatively common, particularly meningiomas, gliomas, and choroid plexus tumors. While advanced imaging techniques like CT and MRI can help us detect lesions in the brain, they often can't definitively determine the cause, whether it's a tumor, inflammation, or something else entirely. That's where a brain biopsy becomes crucial, providing a definitive diagnosis through microscopic examination of the tissue.
So these 3D printed guides, they aim to make that biopsy process safer and more precise. Can you explain how they actually work?
Researchers use CT scans of each dog's skull to create these patient-specific 3D printed guides. These guides act as custom-fitted molds, essentially directing the biopsy needle with a high degree of accuracy.
That's quite an image. Now tell me about the study itself. How do they test the accuracy of these 3D printed guides?
They used 10 canine cadavers and implanted small spherical tumor models into specific brain regions, the fronto-olfactory and piriform lobes, to mimic real tumors. They then used the 3D printed guides to target these implanted tumor models, as well as predefined anatomical landmarks within the brain. And to assess accuracy, they utilized both standard CT imaging and a more sophisticated 3D volume rendering technique, which allows for remarkably detailed visualization and measurement.
So they essentially created a very controlled environment to test out this new technique. What were the results? Did these 3D printed guides improve accuracy?
The results were incredibly promising. Across all insertions, the average needle placement error was just 2.1 millimeters, which is a remarkable level of precision when you consider the delicate and complex nature of brain tissue. And importantly, there was no significant difference in accuracy between the two lobes that they targeted, suggesting that this technique can be effectively applied to different areas of the brain.
2.1 millimeters. That's astonishingly precise. What specific advantages do these 3D printed guides offer over kind of existing techniques?
They provide a number of benefits. First and foremost is customization. They're tailored to each dog's individual skull, potentially leading to a better fit and increased safety compared to traditional stereotactic systems, which can be bulky and difficult to adjust precisely. This customization also makes the guides more user-friendly and less reliant on specialized training, potentially making brain biopsies accessible to a broader range of veterinary practices. Additionally, these guides allow for multiple tissue samples to be taken during a single procedure, which increases the likelihood of obtaining a successful diagnosis. Finally, and importantly for many pet owners, they offer a cost-effective alternative to some of the more advanced neurosurgical techniques available.
It sounds like these 3D printed guides could significantly improve the safety and efficacy of brain biopsies in dogs. But I imagine there are also some limitations to this technology. Can you tell us about those?
Of course. While the study's findings are encouraging, it's crucial to remember that it was conducted on canine cadavers. And we need to see how this technique performs in living dogs, where factors like blood flow, CSF, and tissue movement come into play. Additionally, the design and 3D printing process is currently time-consuming, averaging around 249 minutes. While this might not be a significant issue for, non-emergency biopsies, it could potentially pose a challenge in urgent situations.
Those are important considerations. Are there any other limitations worth noting?
While these guides offer remarkable precision, they also inherently limit the surgeon's ability to adjust the needle's trajectory during the procedure if unexpected anatomical variations or obstacles arise. So this inherent trade-off between precision and flexibility is something to consider. Finally, this study relied solely on CT scans for creating the guides. And future research should incorporate MRI, which often provides a more detailed visualization of brain lesions.
So while this research demonstrates a significant potential, we need further investigation to assess how this translates to a clinical setting in living dogs.
Absolutely. The burning question now is, how will this technology perform in real-world practice? Will it truly improve diagnostic accuracy and lead to better outcomes for dogs with neurological conditions?
You've certainly given us a lot to think about already. Now let's shift our focus to the study's methodology. Can you walk us through the specifics of how these 3D printed guides were designed and how the biopsies were actually performed?
Of course. Let's start by examining Figure 1 from the research article. You'll notice that the 3D printed patient-specific brain biopsy guide, or 3DPS-BBG, is actually composed of several intricate components. The 3D printed patient-specific brain biopsy guide, or 3DPS-BBG, is actually composed of several intricate components. You have the main body, which serves as the foundation, and that's what's customized to the individual dog's skull. This ensures a precise fit. There are also these adjustable arms with a locking mechanism which can be moved and secured to accommodate different needle angles and target locations within the brain. And finally, there's the needle guide itself. This is a small tube-like structure that directs the biopsy needle along that precise trajectory. So it's really a system designed for accuracy and flexibility.
So taking a closer look at that figure, it looks like there's also a targeting device depicted there. Can you explain what role that plays in the procedure?
Ah, yes, the targeting device. This is a separate component, but it's essential for ensuring that the 3DPS-BBG is properly aligned with the dog's skull during the biopsy. Essentially uses fiducial markers, these small radiopic spheres, and they're implanted in the skull. And these show up very clearly on CT scans, so the surgeon can use these markers as reference points to precisely position the targeting device and subsequently the 3DPS-BBG on the dog's head.
Okay, that makes sense. So they're using these markers as landmarks to essentially line everything up perfectly. Now, can you walk us through the actual biopsy procedure? Like, how is the needle inserted and how do they ensure they're sampling the right tissue?
So once the 3DPS-BBG and targeting device are securely in place, the surgeon makes a small incision in the skin and then carefully drills a burr hole through the skull. This creates an opening for the biopsy needle to pass through. The needle guide, remember that tube-like structure we talked about, is then positioned over the burr hole, and the surgeon inserts the biopsy needle through that guide. The length of the needle's insertion is determined based on preoperative planning and the specific target within the brain. So the 3DPS-BBG ensures that the needle follows that predetermined trajectory. To ensure they're sampling the correct tissue, they can actually use image guidance during the procedure. So they might take additional CT scans with the needle in place just to confirm its location before obtaining the tissue sample.
It's amazing how this technology essentially transforms what was once a very imprecise procedure into something far more controlled and precise.
Yeah.
But let's move beyond just the mechanics. The study also went a step further and analyzed the accuracy of these 3D printed guides using a method called 3D volume rendering. Can you explain what that is and why it was important in this context?
3D volume rendering is it's a sophisticated imaging technique that essentially creates a three-dimensional model of the brain and the surrounding structures. From a series of two-dimensional CT scans, this allows for incredibly detailed visualization of both the anatomical landmarks and the position of the biopsy needle. It's important in this context because it provides a more accurate and comprehensive assessment of needle placement error compared to traditional CT imaging alone.
Okay, so they're essentially creating a 3D map of the brain to really pinpoint where that needle is. And the study's findings using this method were quite impressive, weren't they?
They were. The 3D volume rendering analysis showed that the 3DPS-BBG guided needle placements were highly accurate. The average error was just 2.1 millimeters, which again is incredibly precise for a brain biopsy. And there was no significant difference in accuracy between the two lobes targeted, and the accuracy was consistent across different needle angles.
So we're talking about consistent and very precise targeting using these guides.
Yeah.
Now, the researchers also evaluated the potential benefits and limitations of this technology. Can you shed some light on what they discussed?
Sure. One of the key benefits they highlighted was the potential for improved safety. Because the 3D EPS-BBG is customized to each dog's skull, it minimizes the risk of damaging critical structures during the biopsy. It also, as we talked about, it reduces the reliance on the surgeon's subjective judgment for needle placement, which could be especially beneficial for less experienced surgeons.
It seems like this could be a real game changer in veterinary neurology, especially in terms of making this type of specialized procedure more accessible to a wider range of practices and surgeons. Are there other potential benefits they mentioned?
They discussed the possibility of using the 3DPS-BBG for other neurosurgical procedures in dogs, such as delivering chemotherapy directly to brain tumors, or even placing electrodes for deep brain stimulation, so the applications could extend far beyond just biopsies.
That's quite fascinating. But of course, with any new technology, there are also going to be some challenges and limitations.
Yeah.
What do they identify as potential drawbacks to using these 3D printed guides?
One of the main limitations, as we touched upon earlier, is the time required for the design and the 3D printing process. Currently, it takes an average of about 249 minutes, which is over 4 hours from start to finish. So that's definitely a factor to consider.
Especially in urgent cases.
That's a significant amount of time. Are there any other concerns? They also noted that the current design of the 3DPS BBG, it only allows for needle insertion at a fixed angle once it's in place. So it doesn't provide the surgeon with much flexibility to adjust the trajectory during the procedure if necessary.
So essentially, it's trading off a bit of flexibility for that added precision. Anything else to keep in mind?
One more thing. As with any surgical procedure, there's always a risk of complications. And while the study didn't specifically evaluate complications, it's important to acknowledge that bleeding, infection, or even damage to surrounding brain tissue are potential risks associated with any brain biopsy, regardless of the technique used.
That's an important point to make. So it seems like there's a delicate balance between the potential benefits and the inherent limitations.
Yeah.
What were the researchers' overall conclusions about the potential of this technology?
Their overall conclusion was that the 3DPS BBG shows promise as a safe and effective tool for guiding brain biopsies in dogs. They emphasize, though, that further research is definitely needed in living dogs to confirm its clinical usefulness and to fully evaluate any potential complications.
Well, this has certainly been an insightful deep dive into a very innovative approach to brain biopsies in dogs. Now, let's move on to discussing the specific results the researchers obtained using these 3D printed guides. Can you tell us about the key metrics they used to evaluate accuracy?
Absolutely. Let's take a look at Table 1 from the research article. This table presents some really interesting data. Table 1, it presents some really interesting data regarding needle placement accuracy. They measured the error in millimeters for both the targeted tumor models and for those predefined anatomical landmarks. And they looked at the accuracy in both the X, Y, and Z planes, which essentially gives us a three-dimensional understanding of how close the needle was to its intended target.
So looking at this table, it seems like the error was consistently very low across all those measurements. Is that right?
That's right. The average needle placement error for the tumor models, it ranged from just 1.7 to 2.5 millimeters, depending on the plane. And for the anatomical landmarks, it ranged from 1.6 to 2.4 millimeters, so consistently under 3 millimeters, which is, again, remarkable precision.
That really is quite impressive. Now, they also use some fairly advanced statistical analysis in this study. Can you tell us briefly about that and why it was important?
Sure. They used a method called analysis of variance, or ANOVA, and this allowed them to compare the accuracy of needle placement between the two different target lobes, the frontal olfactory and the piriform, as well as across different needle angles. And the key finding from this analysis was that there were no statistically significant differences in accuracy between those different variables, which again supports the idea that this technique is very consistent and reliable.
So essentially this statistical analysis, it's just providing further evidence that these guides are working as intended and they're producing accurate and consistent results.
Exactly. It's adding another layer of scientific rigor to the study and strengthening their conclusions.
Okay. Now, beyond the numbers, what are the practical implications of these findings? How could this technology potentially change how brain biopsies are performed in dogs in the future?
Well, I think this research has the potential to really revolutionize how we approach brain biopsies in dogs. By providing a more accurate, a safer, and potentially even a more accessible method for obtaining these crucial tissue samples. I think it could lead to earlier and more accurate diagnoses of brain tumors and other neurological conditions, and ultimately to better outcomes for our canine patients.
It sounds like a very promising step forward in veterinary neurology.
Yeah.
And one that could have significant benefits for both veterinarians and for dogs.
Absolutely. And I think this study, it really highlights the incredible potential of 3D printing in veterinary medicine. This is just one example of how this technology is being used to improve animal health. And I'm certain that we'll see many more innovative applications in the years to come.
This deep dive has definitely given us a fascinating glimpse into that future. For our listeners who want to learn more about this specific research or delve deeper into the world of 3D printing in veterinary medicine, we'll include some helpful links in the show notes.
And from Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.